That was super informative. The link between climate change and adolescent well-being is so clear to see, and it makes the call for high-level commitment even more urgent.
Definitely, De Graft. I'm anticipating big things to come out of that session. And the sexual reproductive health and rights session really highlighted how youth and adolescents' choices vary depending on where you live in the world. So, time's up for your next core sessions, and they are building the agency of adolescents through quality programming and accountability. It's International Day of the Girl Child today, and this is your chance to join other young people, including girls from marginalized communities, in a conversation about gender justice, education, well-being, and it should be an incredibly fascinating conversation. Or you could find out what's happening in the USA if you choose this one, Taking Action for Adolescents, and this is all about the United States National Adolescent Health Action Plan. So join our colleagues there to hear more about this initiative and how it provides support for youth accessing health services.
Sounds super interesting. And hold on to your hats meanwhile for something quite inspiring and moving. You are about to see the winners of the Art for Wellbeing competition in the design category. So enjoy. We'll be back after the call sessions as usual. Drum roll.
My name is Arsana Karki. I am an artist and a law student. I am 22 years old and I'm from Nepal. Thank you so much for this wonderful opportunity. For me, it is a significant milestone in my art journey. It is wonderful and fulfilling experience to share my platform with different diamonds artists and having a different diamonds thought process. I'm really honored for that. So taking part in this competition is one of the best things that I have ever done, because I had chance to not just share my platform, but I have chance to express myself, what actually it feels to be alone, what it feels to be heard, what everyone needs someone to listen your overall situation no matter what. So this competition had taught me you don't need to be more, or you don't need to be big in your age, but you can make a positive impact in your life. One thing that everyone should realize, that pain is not what you see, pain is what you actually feel. So I had a professional as well as thought process development, so I'm really motivated to explore and create such art which really has a positive impact in my society and my life. Thank you so much.
El bienestar es estar bien con tu mente, es estar en un viernes con tu gente, como superstar en un rap contundente. Se trata de superarse y vivir el presente. En el rap demuestro autonomía y resiliencia. Si me quiero expresar, nadie me silencia. Tengo silenciador por una recarga de conciencia. Si te identificas con esto, no es una coincidencia. La base de mi autonomía es mi autoidentidad. Mi origen son las letras, un autóctono verbal. Autonomía es tomar la decisión de rapear y digan lo que digan, en consecuencia actuar. Bienestar es poder expresarme al cantar. ¿Y qué más da? Soy feliz al momento de rimar. Ya, contribuir a la sociedad se vuelve algo vital. Eres único y recuerda, tienes algo que aportar. Como músico de letras lo debes comunicar. Encuentra valor en ti mismo ayudando a los demás. No temas expresar lo que hay en tu corazón. Escúchate este tema y conecta con tu pasión. Estoy contratando letras a medio tiempo para hacer empleabilidad en una canción. No pierdas el rumbo, invierte en tu educación. Nunca veas al estudio como una obligación, sino como una oportunidad de reflejarse en el bello mundo del aprendizaje. Bienestar es poder expresarme al cantar. ¿Y qué más da? Soy feliz al momento de rimar. Ya, libre de practicar mis creencias, intimidad con mi rap y las letras, sin discriminar, libertad de conciencia y desarrollarse como consecuencia. Son secuencias de sonido diario, solo buenos hábitos alimentarios. Yo me alimento de rap y diccionarios, mi cabeza llena de enciclopedias y glosarios. Salud depende de una buena nutrición, futuro depende de una buena educación. Desarrollo es vivir sin discriminación, bienestar es escuchar la rap generación. Bienestar es poder expresarme al cantar. ¿Y qué más da? Soy feliz al momento de rimar.
Rien n'est plus bon, satisfaisant qu'un simple bel sourire, juste parce qu'on est heureux. Tout ça pour soi, pour son bien-être, afin d'être responsable de son propre bonheur. Je n'ai pas ce que tu as, je serai ce que tu es. Je suis fier de ce que je suis. Oh no way. Nous savons être communs, nous sommes tous humains. Soyons fiers de ce que la vie a nous offert. Non, on est tous différents, les sens sont si différents. J'accepte ce que je suis, accepte ce que je suis. Peu importe mon physique, ni mon état de santé, mon bien-être au mien, que tout ce que j'aurais voulu avoir. Je suis fier de ce que je suis. Sois fier de ce que je suis. Accepte ce que je suis. Fais ça pour mon bien-être. Je sais très fier et satisfait de ce que j'aime, même comme vie. Me réveiller chaque matin, entouré des gens qui m'aiment bien, qui comprennent bien ce que je suis, qui comprennent bien ce que je ressens, qui m'acceptent que je suis. On est tous différents, des sensations différentes. J'accepte ce que je suis, accepte ce que je suis. Peu importe mon physique, ni mon état de santé, mon bien-être au mien, et tout ce que j'aurais voulu. On est tous différents.
Good day, everyone, and a heartfelt welcome to our webinar today. I really want to express our sincere gratitude for you joining us from all over the world. Your presence here means so much to us. Today, we're gathered under the banner of Plan International, Population Council, Hennepin Healthcare, and Aki Parati as we explore the topic Building Agency of Adolescents through Quality Programming and Accountability. My name is Daniel Mullings, and I'm a TV host slash moderator from Kingston, Jamaica. I've actually been hosting and moderating the overall Global Forum for Adolescents, and it's so amazing to now be, in a specific session and looking at this issue of adolescent agency. So, my journey into the world of technology and healthcare began with a deep-seated passion for making a positive impact on the lives of young people. The pandemic really showed me how important agency is for young people and health outcomes. And at the time I served as guild president for the local university in Jamaica, I watched as students no longer having this central space to access the clinic or mental health services because of lockdowns really impacted them. Thus, I think we can all agree that agency is really important. But we have to answer this question of what exactly is agency. And to that end, on the next slide, you're going to see some instructions around how to utilize our Mentimeter, right? So we're going to ask each of you to describe agency in one word as we start to debunk and look at different perspectives on it. All right, so a link should be shared in the chat in order for you to access this, or you can go to menti.com, just enter that into your browser and enter the code that you're seeing right here on screen. So the code is 6665989. And we want to know from you what comes to mind rather. What's one word that you would use to describe agency? And we're just gonna bring up some of those results on screen so that we can start to see what kind of feedback we're getting from you. So everyone, please, give us some feedback. Let's see what's one word to describe agency. And I'll start to tie that into a little bit of our introduction around agency. So, just to keep the conversation going, like in this webinar, we're really going to delve into this concept of agency and its profound influence on health and well-being of young individuals just like us. So, we previously asked you to put that one word in, and we're clearly seeing some themes come across of, I believe, flexibility. I see that coming up on my end, and that need to also include mental health in that need for agency. So persons need to have their own choice. They need to have power, autonomy, control. Those are some of the responses that we're seeing come in. And we'll soon bring that up on screen so that you can see it. So that being said, agency is a multifaceted concept. It's about our own personal ability to act and make free and informed choices to pursue specific goals. It goes beyond mere decision making. It's the capacity to set goals, develop plans, believe in our own abilities, and then take meaningful action towards those goals. When we talk about agency, we're encountering terms like self efficacy, self esteem, self worth, identity, perseverance, positive beliefs about the future. And that's tying into a lot of the words that we're seeing coming in from you, our audience, right? And so these concepts all contribute back to our idea of agency. Now, what influences agency among adolescents? It's a complex interplay of various factors. It's influenced by age, gender, socioeconomic status, so many things going on, really. Education, race, religion, ethnicity, sexual orientation, gender identity, disability, and even geographical location. All of these factors can either bolster or limit an adolescent's sense of agency. And we also have to look at the fact that, agency is shaped by factors at multiple levels. You look at the individual level, the interpersonal level, the community, and even the macro levels. Policies, laws, sociocultural norms, and economic forces all play a role. So when we look at supportive family relationships, uh, enriching peer groups can really enhance that sense of agency by fostering a positive self-esteem and confidence. Now, conversely, you'd look at how unequal power dynamics and structural discrimination can restrict agency, and even, well, restrict agency by limiting access to resources and opportunities. So why does agency matter in the context of youth health? Like, this is really what we're going to be tackling here today. The choices we make or access to information, all of this is going to really to advocate for our health, and it all influences our level of agency. Now, recognizing and understanding that these factors, looking at how these factors impact us, all of that is going to be crucial to empowering young individuals to make informed decisions and take control of their health. So, that being said, nice introduction. Everybody has a good context of what we're going to be discussing here today. And now I have to introduce some of our great speakers. We're going to delve into this topic a little bit further. So let's go to the next slide, which has our panelists on it. And of course, you're going to see Niall Deng, Lalita, and of course, Christina. So I'm so excited to be speaking with all of you here today. If you guys can just say a quick hello, a quick hi before I go into the questions. Yep, I know they're there. So, first question, how do you see your identity influencing agency and vice versa? So, for this first question, we're going to start off with Lalita, and we actually have a video response from Lalita. So, we're about to throw to that video where she'll really answer that question of how does identity influence agency. Over to Lalita's video.
Hello and namaste everyone. It is my pleasure to join this session of the Global Forum for Adolescents. My name is Lalita Tamang and I am 19-year-old girl from Nepal. To me, agency means having the voice and power to take ownership of my well-being, to empower and advocate for the rights of youth like me. It makes me feel empowered to make decisions and take responsibility action independently. It drives me to address the issues I am passionate about tackling, like child marriage, bullying, harassment, online abuse, climate change, child labor, etc. for social change. For this, I have been involved in social programs for adolescents, leadership and education, as well as campaigns to address challenges we face like safety, child marriage, COVID-19 and more and more. For example, at the school, we organize peer educator session about online abuse and child marriage and mental health as well. In this session, I found many youth are facing the issues and many of them address them, and others were getting counseling for and support also. Through this work, it was very clear that for us adolescents, having our agency and having our voices heard is so important to make sure policies and programs support for our health, safety, education and futures. Thank you.
All right, thank you so much, Lalita, for that intervention. And she's highlighting that need for policies to ensure that adolescents have that agency in day to day life, especially when it comes to health. So, over to you, Neil. What's your perspective for this same question of how does your identity influence agency?
Thank you so much, Danielle, and I'm grateful to Plan International for having me in this very important discussion. My name is Niall Deng. I always struggle with identity. My background, has put me through different countries and different contexts. I'm originally from South Sudan, but I've never been to South Sudan. I don't even know how it looked. My dad fled the first Sudanese civil war, moved to Ethiopia, where I was born. And then in Ethiopia, growing up, my dad wanted to give me a sense of belonging to South Sudan. And the only way he was able to do that was through storytelling. So storytelling became very important to me as a kid because it gave me a sense of belonging to South Sudan. But it also gave me some sort of hope, I would say, because through storytelling, my dad showed me how I can achieve my dream, how I can go to school and good English, become a journalist, which was my dream as a kid. And then in 2010, everything turned upside down. My village in Ethiopia was attacked by a militia group, and I had to flee to Kakuma refugee camp in Kenya, where I spent 11 years there before moving to Canada in 2021 for my undergraduate studies. And in Kakuma refugee camp, that is where I started my community work. And looking at my background, as someone who grew up as a refugee, without my parents in a refugee camp, agency to me means having the tools and opportunities to create a better future for myself and my community. It means having the opportunity to be able to get a good education and the resources not just to achieve my dreams, but also to be able to help other people in my community achieve their dreams as well, which means becoming a leader in my community. Agency also means having a strong voice and a platform to share my own story in my own voice, which is vital for preserving one dignity. And this is why today storytelling and education are at the heart of my advocacy work, because I believe that through storytelling, through education, you're able to not only connect with your own self, connect with your own identity, but you're able to have your own agency and be able to chart your own destiny forward toward a brighter future for yourself and also for your community. Back to you.
Wow, thank you so much. I like that focus on the community. Over to you, Christina. How do you see this question of identity versus agency?
Yeah, so hi everyone. My name is Christina Lan. I'm calling in from Minneapolis, Minnesota, and I'm currently a medical student. So for me, as a biracial woman in a predominantly white country and state, I think I've always been drawn to understand the world through multiple lenses. Never fully fitting into one community and always kind of being on the margins has allowed me to extend empathy to those who also don't fit the status quo, even if we don't necessarily share the same identity. I recognize that we are all greatly influenced by our backgrounds and surroundings, and that I really value the unique stories and experiences that shape our differing identities. As a result, I've always been intentional in finding community work where I'm able to serve others from varying backgrounds in a manner that's culturally relevant and prioritizes those who are underserved. I think as a Taiwanese and Chinese woman, I believe my cultural values of community and prioritizing the collective over individualism have also really influenced me. And to me, agency isn't just about making decisions for myself, it's empowering my community around me. So it's really important for me to do what I can to give back to the community in the Twin Cities, especially empowering other youth through youth programming that I've always been involved in. Now that I'm in my 20s, it wasn't so long ago that I was going through the struggles that come along with being an adolescent, and being a mentor to young people who are just a bit younger than me to empower them is really important to me. Having adult support and recognizing my own power to promote change in my community was really influential, and so now I kind of want to give that back to youth in my community through the work that I'm doing at Equiparati.
What I like that's coming out from this is in the introduction, we mentioned a little bit about agency being something that's affected at different levels, right? So we have the government level, and of course, what can be done at a community level. And both you and Neil have highlighted that need at the community level. So let's move into this second question then, and we'll bring the question up on screen. Why is the work you're doing important? How does the work you're doing influence agency? Give us an idea of what the connections and the barriers are that you're facing. And Neil, I'm going to start off with you.
Thank you, Daniel. When I speak, before I talk a lot about education and storytelling. I talk about how those two powerful tools can be able to give you the opportunity not only to connect with your own identity, but also to be able to achieve your dreams. And the work I'm doing is very much tied to both education and storytelling. And I believe it's important because it is rooted in the belief that every child, regardless of their circumstances or where they come from, deserve access to education, safety, and the opportunity to fulfill their dreams. It is about recognizing that these are not privileges, but fundamental human rights that every child everywhere in the world should have access to. By focusing on children and young people in displacement and emergency context, we're able to address a particular very vulnerable and marginalized group, ensuring that not only behind in being able to achieve the UN Sustainable Development Goals, but in also building a better world that works for everyone. And this work influence agency by providing the tools, resources and platform necessary for the young people to have a say in their own futures, and empower them to become active participants in shaping their destinies and the narrative surrounding refugee issues. In essence, it grants them a voice and a sense of control over their lives, which is at the core of agency. And the connection between this work and agency is profound. Agency is about more than just the ability to make choices. It's also about having the means to act on those choices by ensuring that children and young people in displacement and emergency contexts have access to education, mentorship opportunities. We equip them with the means to exercise their agency. They can then make decisions about their education, career, community involvement, leading to a brighter and more hopeful future for themselves, their families, and their communities. However, there are barriers to achieving this vision. In many cases, it's structural and systematic challenges such as limited access to education, discrimination, resource constraint, hinder the realization of these opportunities. Additionally, there can be political as well, political, social, and economic barriers that affect the ability of displaced and emergency affected population to access their agency. Today, we know in the world that there are about 100 million displaced people, that have been affected by war, conflict, climate change, and other emerging global challenges. Overcoming these barriers require collaborative efforts, advocacy, policy change, resource allocation to ensure that every child and young person everywhere in the world has the chance to thrive and shape their own future. Thank you.
Very important themes coming out there, Neil. And just to say, on behalf of all the young people, thank you for the work that you're doing. It's very important. And you're highlighting that there are many structural and systemic challenges or barriers to this. And so I'm going to ask the next question, which Lalita will respond to via video. And that is, from your perspective, how was agency as part of adolescent health and well-being featured at the recent Girls Deliver pre-conference on adolescent girls? What were some of the connections and barriers? Over to Lalita's second video.
This July, I had a chance to be a co-MC at the Girls Deliver pre-conference on adolescent girls in Rwanda, ahead of the Women Deliver 2023 conference. It was such a great experience to be part of a global group of adolescents and adults all working together to improve adolescents' lives. I got the chance to meet wonderful peers like Kalpa and Condoleezza and well-known faces who inspired all of us like Malala Yousafzai and Stacey Abrams. In this session, Malala said that we all have power. We can use it anywhere in any time. We should continue to use our voices for whatever challenges arises and believe in ourselves. And like that, Stacey said that if we trust in own power and work, then no one can stop us or silence our voices. So we need to continue our work. I learned so many new things and got the chance to share my country's issues, which are like many others. Our issues are often often the same no matter where we are from. So our motto and goal to in social issues and empowering youth are also the same. That's why we need to coordinate and work together globally. I saw firsthand how important agency is for our health and well-being as well. And we heard from over 90 adolescents and youth participants, and their message was loud and clear. We created spaces for adolescents, especially girls, to lead. For adolescents to take ownership of their lives and their futures, we must be able to meaningfully participate to lead, and not only together with other young people but also included with all other stakeholders of all ages. So agency is also one of the many important pieces to our health and well-being. At Girl Deliver, we emphasize that the lives of adolescent girls are not centered around single individual issues. Our lives are not only about agency, education, sexual and reproductive health and rights, economic empowerment, or climate change. Rather, girls' lives are shaped by the interconnection between these issues. So to empower adolescent agency to improve our education or health, we must tackle these issues all together. This integrated approach with adolescents at the center is needed to all levels, including policies and programs. Like holistic adolescent center programming can also have a real impact on agency and many other areas. Like for example, for group-based training to build life skills and agency for girls, and evidence and lesson from implementation shows that local female mentors who are slightly older than group members and are trained, supported, and paid can make like a big difference in impact. All of these activities must be driven by data and evidence. We need quality, accessible data and evidence on adolescents, especially for concepts like agency that are more challenging to measure than statistics like contraceptive usage rates. We also need to document and use implementation lessons. Evidence should be used to direct limited resources to programs and policies that are proven to be effective in improving like adolescents' lives. This is an important part of the conversation because global meetings and political commitments are most meaningful when they can truly impact adolescents, especially those who don't have access to global forums like this one. I hope we will be able to see the connection between high level convenings and measurable benefits for them. Thank you very much.
I don't think we can hear you, Danielle.
Whoops, yeah. Sorry about that. Yeah. So I think Lalita raised a lot of important issues in that statement. Some of the ones that really stood out to me was this idea that we, as young people, we're not just any individual issue. Like, we're not just climate change issues, we're not just agency, education, sexual and reproductive health rights, etc. But we exist at an intersection of all of these issues. And the other point she made about that need for data is so important, because data driven advocacy is really, really meaningful. So, that being said, Christina, we're going to go over to you to look at this same question of, how is your work kind of being influenced by this idea of agency, or how is your work influencing agency? And of course, we're going to show some slides as you speak just to highlight your work as well. Over to you, Christina.
Thank you. Yeah, so to start off, I wanted to give a little bit of context of why my work is important in a healthcare context. Like I mentioned, I'm a medical student, and I'll give a little more details on the work that I'm doing in the clinic. But basically, I wanted to discuss how identity influences adolescent health and how, especially for me as a future healthcare provider, I want to frame positive youth development as a protective factor for health. And I think this framework is important. It's not always centered in medicine or medical training, especially in a patriarchal medical system, especially how we have it in the United States, where the doctor is often seen as the one who knows best and the patient is more of a passive participant in their care. And I feel like this can especially be true when patients are youth, and that can be very disempowering. So with positive youth development, we're really trying to kind of flip the script and not just focus on negative aspects in preventing care, but focusing on the positives and the strengths that youth have. So yes, rather than just focusing on prevention of risky health behaviors, positive youth development promotes building agency, knowledge, and skills that youth can employ to make positive decisions in their lives and in their communities. It emphasizes the strengths of youth while connecting them with supportive adults during a time in their life when they're navigating many challenges and questions about who they are and who they want to be. One aspect of adolescent development that I've especially focused on in my work with youth of color, whether it was back when I was teaching in a classroom or now in the health-related work that I'm doing with young people, focusing on the topic of identity and making sure that youth are developing a positive relationship with their identity is really important. So I talk about that a little bit on the next slide as well. And I think having this conversation with young people, especially in a predominantly white context, is really important. When youth are receiving messages about their identity from the external world, it's really important to have a safe space for them to discuss and explore their identity with other young people, and again, emphasize their strengths and their identities. So the work that I'm currently doing, I'm currently facilitating the Youth Advisory Board at Aquí Para Ti Clinic, which is a comprehensive positive youth development clinic providing medical care, behavioral health assessments, coaching, health education, referrals to Latina youth, young adults, and their parents under the leadership of Dr. Maria Veronica Svetas. And the Youth Advisory Board is a leadership team of young people ages 13 to 19 who identify as Latinx or Latine, and they're tasked with providing vital input to improve clinical practices in a way that they deem effective and culturally relevant. So it's a way that young people can give input onto how the clinic is run and center their experiences since they are the patients. This year, what we've been doing is creating a youth participatory action research project to promote health equity. So if you've never heard of youth participatory action research, it's basically a tool in which young people are empowered as the researchers themselves. And similarly to what I said about medicine kind of often being this like patriarchal construct, research is also often a patriarchal context in which researchers are entering communities, doing research on them, and maybe they don't come from that community or have cultural fluency in that community. So YPAR is a way to kind of combat this by especially focusing on empowering young people to do research on questions and topics that they think are important in their communities. So before we started this YPAR project with the youth, in the summertime, this summer, we built context through a curriculum that I created. And with the youth, I discussed topics like identity, intersectionality, community, and health equity. This curriculum also included field trips to our local science museum, where we have an exhibit that debunks race as a as a social construct and not a biological construct. We also visited a local photojournalist studio where he uses photography to tell stories about community, identity, and social justice. So we did a bunch of context building this summer, talking about identity and building community with one another. Now that the youth have this context, they've just begun embarking on their Photo Voice and Youth Participatory Action Research project. And this is a unique research method because it allows the youth to be the researchers and the subject of research as they reflect on their own experiences and perspectives on health. So in these last few weeks, we started the process of creating a health-related research question as a team. And then what they'll be doing in the next month or so is taking photographs and then that respond to this research question that they co-created. And then next month, we'll come back together and analyze and discuss their photos that they've taken and kind of find common themes. And so as of last week, the question that they've chosen this year is, how does the Latine identity impact youth's ability or desire to access health and health resources? I think this project really influences agency because, like I mentioned, it's empowering youth to take ownership and investigate issues that they find important in their community. It lets them know that their perspective is valuable and that they're powerful and capable researchers. I think one of the biggest barriers that I've encountered in any sort of youth work that I've done that occurs outside of school hours is that oftentimes the youth in the communities that I work with need to work, or they have parents who need to work and can't maybe give them a ride to programming. So one way we've tried to remedy this is making sure that this is always a paid opportunity. We can't just say that we value our youth's voices and then not demonstrate this in a tangible way. And because of this important community work, they deserve to be compensated as such. So that's one way we've gotten around this barrier.
Lot was coming out there, and I love to see when young people are doing important work that also empowers the voice of more young people. So we've had a very rich discussion so far, and I'm about to go into some questions from the audience. But before I do, I just want to encourage our audience members to actually fill in a second Mentimeter. And in this Mentimeter, you're going to share with us one main takeaway that you have from this session. So we're going to continue answering some of your questions whilst you also put in some of your main takeaways here. And then at the end, we'll show some of those responses. All right, so go to menti.com and use the code 88597646 and fill in some of your main takeaways. All right, now before we go into that, one of our audience members asked a very great question. And Niall, I'm going to throw this one to you. So the question is, how do we enhance meaningful adolescent agency in settings that have fragile systems? And this relates a lot to your work. So over to you.
Thank you, Danielle, for that question, and thank you to the audience member who asked that question. I think, as I mentioned earlier, family, I believe that education is a very powerful tool. in context, in displacement context, in refugee context, that give young people in those communities the opportunities to be able, to be able to achieve their dreams. And when I look at education, especially in the context of agency, to me, I remember, when I had the opportunity to go to school in Kakuma refugee camp many years ago, education was more than just a place of learning for me. Education was a place of solace. It was a place where I was able to find hope, and I was able to find healing, and where I could just sit down again as a child and think about a glowing future. But again, there are barriers. I think education should be able to translate in those contexts to an opportunity to young people, to be able to not just dream, but actually to realize their dreams. And how do they realize their dream? They realize dream by ensuring that education is not just a one-way, sort of process where young people go to school and they graduate and then what happens next. For example, in Kakuma refugee camp, many young people in that refugee camp are not allowed to work. The policies in place do not allow refugees to work. So many young people would often go, for example, to school, and then they graduate and they come and hang their degrees at the houses because they're not able to work. So I think education should be able to create those pathways for young people to be able to transition to employment, to be able to transition to entrepreneurship, to be able to transition to leadership in their communities. And it should be something that build on those blocks that young people can then translate into other ways to be able to get where they want to be. So I think I think that is one way education can help. In sort of giving agency to young people in fragile settings. I think something that's also very important, and this is something that I've talked a lot about, is that the best solutions to most of these crises that put young people in very vulnerable solutions is ensuring that there's peace. I've mentioned earlier that I believe that peace, education, and dreams should not be luxuries for any child. They should be basic human right. So I firmly believe that this did for people, the private sector, the general public, politicians to come together and ensure that these communities that have been destabilized, by conflict, by many crises for so long, are peace, and people there can live, in peace and be able to achieve their dreams. Thank you.
Thank you so much for that, Niall. And I want to throw the question to Christina as well, but slightly tweak it. I'm very curious for you, coming from that Latin American context, for you, how do we enhance meaningful adolescent agency in the spaces that we're in? You're using like an academic setting kind of to do that. How do we continue to enhance that meaningful adolescent agency?
Yeah, I think just continuing to provide spaces for youth where they can be imagining a future for themselves and their community, and ensuring that those spaces are youth led. I think as adult supporters, it's really about creating a supportive space and then allowing the youth to take that space and create with it what they will. They have a lot of ideas and visions and dreams, and it's really just a matter of us giving them the resources to enact them.
Because as we're looking at enhancing agency, there's like a role to play on both sides, right? One, it's empowering the youth voice within that, and then also empowering our allies to be better allies, and assist. So that being said, let's move into one more question here. And this looks at you as young activists like yourselves. As young activists and leaders, what are some of the main challenges that you face in your own work, and how do you balance your work commitments and your own individual mental health and well-being? And Niall, I'll start off with you.
Thank you so much. When I was in high school, I love getting involved. You'll find me everywhere at this school. I'm here, I'm there. My teacher told me that, for you to be able to do all these things, for you to be able to do all this work you do in school, you need to take care of yourself first. You cannot take care of your family, you cannot take care of your community, you cannot take care of people around you if you don't take care of yourself. So I think from that point, I look at, prioritizing my mental health through all the work I do. Be it ensuring I have time, to just, sometimes listen to music. I love listening to Afro beats and dance. I love reading. Be it taking time off to just, read books of people that inspire me. Taking a walk along the river. Skating. I love skateboarding. I have tried to structure my advocacy work in a way that I believe that I cannot pour from an empty cup. I need to put my mental health first before I'm able to go to my community and help. And I remember, one of the barriers I would talk about, for example, is that as a young person, for example, in Kakuma refugee camp, I led a lot of different initiatives there in the camp. And I think when you look in, for example, fragile and displacement context, when it comes to activism, it comes with a lot of barriers. Sometimes, in some contexts, it could be risky for young people. Be it, it could, get them in problem with the authorities because of what they say, because of what they say online. It could sometimes, put your whole family at risk. So these are issues that could arise. But I think for a lot of young people, I think, sometimes they're saying that, young people, can get a seat at the table, or, they can just grab a seat and be at the table. I don't think it's something that you realize in many contexts, because you'll find when young people are invited to the room, they're invited to the room when decisions are already made in those rooms. Young people do not have the opportunity to co-create. A lot of youth-led, initiative do not have access to funding. They do not have access to the tools and the resources that they need to be able to make change in their communities. And these are barriers that I face, but also barriers that I believe other young people face in their communities. And I'll just imply something that Christina said before, which is how in our context in the healthcare, sometimes the relationship between the doctor and the patient could be very disempowering. And in fragile situation, there's a lot of talk about the donor and the beneficiary, and I find this very disempowering in many contexts. I feel that when you come to a community and treat them as people who don't know anything about the crisis they're facing, who don't know about anything about having a solutions, and those include young people, you create a very disempowering circumstances. But I firmly believe that finding solution to crisis should involve, putting those communities that are being affected by this crisis at the center of finding a solution. That should include listening to the voices of young people and the voices of the community, and co-creating solution with them, and ensuring that they have a seat at the table where actually decisions are not made, where not just where the talking is taking place.
Wow. Okay. So both of you are highlighting that very important need for solutions to be co-created. And it should not be a case in which the solution is created and then we're asked to give our perspectives on it, right? We're including young people at every stage of that process. So Christina, for you, like as an activist, same exact question, like what are some of the challenges that you've had, and how do you preserve your mental health in all of this?
Yeah, I think for me, especially, it's tough because I'm a medical student and that consumes most of my time. And prior to being a medical student, I was an educator and a youth worker, and doing a lot of community organizing. So this transition into kind of back to being in an institution has been a little bit tough, just knowing that my values don't always align with the institutional values. But I think this project I've been doing with Akiparati and the Youth Advisory Board has been a huge breath of relief for me in my week, because this is the work that I feel called to do and I hope to do as a physician someday. So being able to have this opportunity to do this work while I'm a student and kind of get away from the daily stresses of being a student and do youth work has actually been really beneficial to my mental health. And I feel very energized seeing youth being empowered and being exposed to their wonderful, brilliant ideas and having these conversations with them. So that's also been great. Beyond that, I think also creating space in my schedule that's just for me. And, it's easy for me to like get really excited about this work that's outside of medical school and want to put all my energy into that, and kind of like seeking that as my mental health break, but also learning that I need time that is truly 100% dedicated to myself and doing things that are refreshing, like being in nature and grounding and with my community or my friends has also been a way that I make sure that I have the energy to get up the next day and do the work that I need to do as a student, but also as a supporter in this youth work that I've been engaged in.
Wow, thank you so much, Christina. I think both of you are reiterating that it's important to remember that we can't pour from an empty cup, right? And in all this work, all this activism that we're doing as young people, it's important to ensure that we're first okay, so that we can continue to do this important work for other people across the world. So thank you both for that. I have one final question for you. We are here at the first ever Global Forum for Adolescents over 8,000 young people have registered, and are listening into these types of conversations. Like, what would be your message for young people? Like, what would be your parting words that you would want to leave with maybe someone watching from our different watch parties all over the world, India, Brazil, etc.? Niall, do you want to go ahead and start?
Yeah, I think I would start with the power of hope. The other day someone asked me, what did it take for me, to, come from a refugee background and win the Global Student Prize. I was announced the winner of the Global Student Prize at the UN General Assembly in New York 2 weeks ago, and I tell them I think it is the audacity of hope. So I would say to young people, never underestimate the power of hope and your dreams, no matter where you come from. Your dreams are valid. This is something that many people have said, and uh, by being able, to hold on to hope, regardless of the circumstances you go through, you can still pursue your dreams and be able to make them a reality.
Absolutely love that. He said it's the audacity of hope. I love that, young people. Let's hold on to that nugget. And Christina, over to you. What's your parting word to all the adolescents across the world that are tuned in?
Yeah, thank you. I wanted to share one of my favorite quotes all time. It's, "You cannot change any society unless you take responsibility for it, unless you see yourself as belonging to it and responsible for changing it," from Grace Lee Boggs, an Asian American activist. And yeah, I think about this quote every day. It really is what drives me to do the work that I do, even on days that are tough. And I think it's easy to feel overwhelmed by all of the problems in our world, and there's a lot of horrible things that are happening on a daily basis. But reminding ourselves that we are powerful in community and that together we can implement the change that we want to see. So we don't have to feel disempowered and alone. There are many other people doing incredible work, and we just need to find solidarity with them, and together we can change the world.
Thank you so much for that, Christina. You're highlighting the fact that, sometimes we can look at these big issues, this big issue of how do we increase adolescent agency. And when we look at the big issue, it can seem almost scary because there's so much to be done. But it's important for us to look at what we can do within our own communities and then how that all adds up when all 1.8 billion of us come together with initiatives within our communities. So that being said, I want to just quickly share some of the Mentimeter results. And for the technical team, I have put the link in the chat so we can bring up those results on screen so we can start to look at some of them. So we're looking at, off the bat, I'm seeing some that say agency is power. There's a need for better coordination and action to address this topic of agency, especially ensuring that it's evidence-informed programming. So we're looking at that need for data, right? So we're not just, getting up and advocating for things randomly. There's a systematic, evidence-based approach that we're taking in order to achieve this. We also have persons saying that agency is critical to our well-being and health. If we don't have the confidence to make decisions about our own lives, then we can never truly be free, live with dignity, and to our full potential. More persons saying that they're amazing speakers. I agree. We have some amazing speakers here with such diverse backgrounds that really are contributing to this conversation. I see someone also saying that, self-care is an act of resistance. And this really came through when both speakers were identifying, how they have to ensure that they're pouring into themselves so that they can pour into others. And someone says that they're going to make that exact mantra, the one that they're going to make that their mantra for life, that you can't pour from an empty cup. And of course, someone here has highlighted the power of hope, important words to live by, and that need for community and for us all to come together. So that being said, as we wrap up today's webinar, let's really take a moment to reflect on the key points that we've explored. We've delved into this concept of agency, understanding it as the ability to set goals, develop plans, believe in our own abilities, and then take meaningful action towards those goals. We've seen how agency intersects with youth health, influencing the choices that we make, how it intersects with our access to information and our ability to advocate for our well-being. We've discussed the various factors that shape agency, from individual characteristics to those external influences like policies, laws, and societal norms. We've even gotten a little glimpse of how that operates in the backgrounds that our speakers are from, like especially Latin America. Now, Recognizing and understanding these factors is going to be so crucial in ensuring that we empower young individuals to make informed decisions and really take control of their health. So let's all continue to champion agency in our own lives and in the lives of the young people around us. We've reinforced over and over the importance of community and what can happen when all 1.8 billion of us come together to make a change and to demand change from our allies, right? So let's encourage young people to embrace their capacity to act, to make informed choices, and to pursue their goals. And I just love to express my heartfelt gratitude to all of you for your active participation, insightful questions, and meaningful contributions. So many of you responded to our Mentimeter polls, and we're so grateful for each and every one of your responses and that you've enjoyed this session just as much as we've enjoyed having this session with you. So it's your engagement that really makes these discussions truly valuable. So, of course, keep an eye out for future webinars and resources from Plan International, Population Council, Hennepin Healthcare, and Akipa Rati as we continue our journey to empower youth in their pursuit of health and well-being. Stay empowered, stay informed, and take control of your health. Thank you for being a part of this important conversation, and I'll see you back in the main room in Geneva with the rest of our hosts for the overall Global Forum for Adolescents. Thank you. Have a great day.